We'll kick this off. Happy May Day, everybody. It is International Workers' Day. And so I'm so thrilled to have three people who I really respect and admire joining us today to talk about what's going on the front lines, how we can celebrate and support our essential workers. My name is Brooke Lehrman. I'm a state delegate representing District 46, along with the rest of my team, Senator Bill Ferguson, and delegates Luke Clippinger and Robin Lewis. Thrilled to represent District 46 in Baltimore City and do work supporting and raising up important issues to support our workers at the state level and working with colleagues from around the state. So before we begin, I just want to make a few quick points about where we are today. You know, since we adjourned, we had our early adjourning of session, the first one since the Civil War. I have been working hard to make sure that I can bring information to you, to all my constituents, to people around Maryland, and anyone who wants to tune in on how we can access benefits, know what's going on at the federal level. Just yesterday, we had a session on taking care of our kids and ourselves. Today, raising up our essential workers. In a week, we'll be talking about the environment and other priorities. So I think it's so important that delegates and representatives not just pass bills, but make sure that we can be advocates and resources for our constituents. And that's what I'm trying to do with these webinars. So where are we today in Maryland? We find ourselves with 23,472 confirmed cases of COVID-19 here in Maryland. Over 1,000 people have lost their lives, and we have more than 1,600 hospitals today. Governor Hogan, of course, has issued a stay-at-home directive. He's closed non-essential businesses. He's expanded telehealth services and prohibited residential, commercial, and industrial evictions. So why are we having a webinar today on this? Well, it's so important. You know, I think one of the things we've learned and seen, if people who didn't know already, is how essential so many of our workers are that we take for granted. Our workers are going out, keeping the world turning every day these past few months. You know, I like to say at the end of every webinar, I talk about, you know, we are here in the luxury of our own homes and able to do these and able to watch them. But we're only here because so many people are in their homes, because they're out picking crops and getting, you know, our farm workers, our fishermen, our grocery workers, our healthcare workers, our transit drivers. And today, I'm so pleased to have this webinar be about those people who are out on the front line. So without further ado, I'm going to turn it over to our speakers. They're each going to speak for a little while about the workers and the situation on the ground and what they're seeing. And then we had a number of questions come in. So I'm going to go over some of those questions and ask for some feedback from our team here. So first we'll start with Denise Gilmore, who is Field Director for AFSCME Council 3. AFSCME Council 3 represents state and higher ed employees in Maryland. And Denise, I'm delighted to have you here today, and I'm gonna let you kick us off.
Delegate, well, first off, happy International Workers' Day, everyone.
Yes.
Delegate Lehrman, thank you so much for giving us, you know, this platform to really discuss what's happening out there with our members. You know, I think it's fitting that on International Workers' Day, we really take a look at what the essential frontline work is that's happening in our country right now. And really, you know, we're hoping that as a result of this crisis, you know, we expand certainly the definition of what's considered essential work and frontline work. I mean, obviously it's our healthcare providers in the hospitals, you know, police, fire, but I think this crisis is really showing that, you know, it's also, it's the bus driver, right? It's the nursing home employee. It's our, you know, local and state government employees. You know, we represent state government employees and employees who work in Maryland's public higher education institutions. And, you know, if it's corrections, if it's working in our state mental health hospitals, if it's, you know, performing the unemployment claims and, you know, helping Marylanders through that tough process right now to, you know, checking and making sure that, you know, we're still guarding against, you know, vulnerable, you know, abuse of adults or children. We've got state workers right now on the front lines every single day. You know, not only doing their part to make sure these essential services are still coming to Maryland, but working on trying to prevent the spread further into the communities. You know, I would say, you know, what our members are facing right now is, you know, they're definitely requesting more testing to be done.
Right.
You know, it's incredibly crucial that we have access to tests so that we can, you know, test both, you know, symptomatic, you know, essential employees that are showing up to work and the people that they care for or, you know, have custody of, but also the asymptomatic folks. I mean, we've seen all over the country, you know, where states like Ohio, Michigan, you know, North Carolina have really put in, you know, systemic programs to increase testing in these large 24/7 institutions. We're seeing just how high the numbers of diagnosis are, right? And I think to really get a handle of how we isolate cases and help with spread, you know, testing's pretty critical. So, you know, we're pushing that everyone gets tested, you know, symptomatic or not. You know, certainly that's showing up to work right now. Along with that, you know, our members are experiencing PPE shortages all over the state. I mean, I know this is something that, you know, we're seeing in many industries right now. But you know, sorry, I didn't mean to get, you know, emotional on this. I mean, many ways, you know,
No, it's
I've known these
it's
members.
scary.
I've known
Yeah.
these members, you know, for 10 years. They're really like family members.
Yeah.
Right now going into facilities, they've got surgical masks that they're being asked to reuse for 2 weeks. They're going into quarantine wards without N95 masks. And,
Yeah.
you know,
It's really
you know, we're
scary.
starting to get, you know, more and more members that are coming back that are testing positive. They're afraid, you know, I think they're really afraid. And, you know, to the extent that we can continue to, you know, get out there and you know, provide the realities of what's happening with our essential workers, you know, just in instances like this, you know, we're really appreciative of that, delegate. And I'd say, you know, finally, the last thing that, you know, we're desperately craving are just written plans and actual programs. You know, in the same way that, you know, we've got fire exits, you know, lit all over our movie theaters, right? So we know when a fire is about to hit. You know, we've got to have that same level of planning when it comes to health and safety and infection control. And so those are the fights we're actively engaging in with the state and with the Hogan administration right now. You know, it's everything that we've gotten so far has been because we've had to push for it. Unfortunately, you know, things haven't necessarily fallen into places as quickly as we would have hoped for our members. And you know, I'm disappointed to report that we were supposed to have a meeting, you know, with the state yesterday to you know, ask simple things like, you know, is there a way to you know, do some kind of like mass decontamination of masks and PPEs that you're getting, and they refuse to meet with us. So so I appreciate, you know, the opportunity today to really talk about what's you know, what's happening out there. And you know, my heart goes out to everyone that's on the front lines working right now. You know, as we transition through this crisis, you know, I know another big fear that our members have is, you know, we're going to go from this and next they're going to, you know, be facing layoffs and pink flips potentially, right? So, you know, if there's an opportunity to talk, you know, at all more on this hour, you know, I'd love to share a little bit more about the efforts we have there. But we appreciate the opportunity, and again, you know, definitely keep our frontline staff and folks' thoughts and prayers. They need it.
Yeah, that makes sense. Yep. Thank you so much. And it is, I mean, it makes sense to get emotional. Like their lives are in danger right now. It's a really scary situation. So thank you. I'm going to turn it over to Rikara now. Rikara Jones is the Maryland DC Political Director of 1199 SEIU United Healthcare Workers East. And delighted to have you here to tell us a little bit more about what you're seeing and what your members are seeing. So thank you for being here.
Sure. No, thank you, Delegate Learman. It's an honor to be joined by Denise and Michael, whose workers are also on the front line. But I'm glad that you were able to pull this together on such an important day, right? So I just want to start by saying, like, we are standing in total solidarity with the workers who are striking today at Walmart and Target and Whole Foods. In Amazon. Just want to start by saying that, hoping that nobody crosses the virtual picket line today or the physical picket line, and that, you know, we don't purchase any goods from those companies today. So we're in total solidarity with those folks. I just wanted to start with that. And then I think Denise did an awesome job describing what, you know, frontline essential workers across the board are dealing with. But the thing that keeps coming up to mind for me is as we talk about, you know, grocery workers and truck drivers and housekeeping and folks in dietary, these are the very folks who are keeping our economy moving. These are the very folks that a year ago we were fighting over just getting them $15 an hour, right? So, and I want to thank you for your support for that, Delegate Learman, and, you know, support of your delegation. But we see just how important it is that these workers are. It shouldn't have taken a pandemic for folks to realize that, but they are the very ones, these low-wage workers are the very ones who are getting us all the services that we need, the food that we need, our mail, getting us back and forth to work and doctor's appointments and things of that nature. So I just wanted to acknowledge that. Right now, we represent workers, healthcare workers in hospitals and nursing homes across the state. And I'm sure everybody knows that nursing homes are the new hotspot. And we have a large number of members who unfortunately have tested positive. And it's because, one, you know, a lot of nursing homes were very slow to put in protocols that we all know should have been, you know, placed into in effect pretty soon. We had a lot of difficulties very early on with a lack of testing, even though we had staff members who were working with infected patients and were definitely exposed. We weren't able to get them access to testing. We're still having huge issues with PPE. As Denise said, we are, you know, our members have masks and they're working with positive patients and being asked to reuse those masks over and over and over again.
That's so bad.
We have some examples of like there's one gown per room, so everybody that goes into that room is being asked to wear the same gown.
Oh my God.
So there are just really huge issues. So those are like so our members, as you can imagine, they want to show up and they want to care for their patients. When you think about folks in nursing homes, the staff are really sometimes the only people that they have, especially now. Visitors can't come in. There's nobody to comfort them, nobody to help them with their daily needs outside of the staff. So they feel a duty to show up, while on the other hand, every day they go into these spaces, they are truly risking their lives and risking the lives of their family. I do want to, you know, just say thank you to Michael's members. Many of our members rely on public transportation every day to get to work, to get to drop their kids off at childcare, to get back and forth from the grocery store. But as you know, there have been cuts to the service lines. So they are having a lot of difficulty actually getting back and forth to work because of the cuts. So that's one of the main, that's something else that they're dealing with. And then the issue of hazard pay. So again, as I mentioned before, most of these workers are some of the lowest paid workers, and they're being asked to risk their life and even and haven't received, in some cases, any additional pay. So we've been trying to fight for that, like facility by facility, but it really should be across the board. Nobody should have to go out and risk their lives and not even, you know, and still have to struggle to pay their bills and their rent. And then just the last thing I'll mention was just like a huge oversight. Healthcare workers were left out of and exempt from the federal paid leave legislation. So while other folks are able to take time off or will receive pay when they're sick, healthcare workers do not have that. So that's one of the things that we're truly advocating for on the federal level, because there's no type of coverage for those folks. So
see me, I'm taking notes. Yeah. Wow, that's crazy. And how do they define in that exemption, how do they define healthcare workers? Like who was left out?
So it's very broad. I think they did that on purpose, right? So like all of our workers are covered as healthcare workers. And I think there's even been a fight that people that don't even work directly in healthcare, some of their employers have tried to use that as a reason to exempt them. So we're trying to get the definition to be much more, one, it shouldn't exempt anybody, right? But if it is, we're trying to get it to be a much more defined definition of what a healthcare worker is.
Right. Yeah, narrower. That makes sense. Wow, it's a lot. Thank you. Thank you for all that you're doing to advocate for your workers and for working with us and educating me and other legislators about these things that are going on, and members of the public, so that we can be in touch with the governor and everybody as well. And now I'm really pleased to invite Mike Millen to speak. Mike is the president of ATU Local 1300. And so if you have ridden on a city bus or the MTA subway or the light rail to an Orioles game or to work, or the Mart, you have ridden with some of Mike's members. So thank you so much for joining us today, Mike. And tell us a little bit about what, I know we've been in touch, but tell us a little bit about what you're seeing and what your members are seeing.
Yes, well, thank you for having me. Much respect for Cara and Denise as well. I sympathize, with everything that's going on, because even though we're out there on the front line, our members are going through the exact same thing. Delegate Learman, like you said, we've had plenty of conversations. I thank you for your assistance in the legislation, because it seemed like a lot of things prior to this even happening, before you knew it was going to happen, you were pushing for transit to get more funding. And if they would have been listening to you and giving you what you wanted, then I think we would be as from our operation standpoint, we would be in a better place than we are now. You, Senator McCray, Delegate Bridges, the Senate President Ferguson, I really appreciate everything that you've been doing for the entire Maryland. That's really appreciated. And also, just to give you a little bit about what the Frontline, in which for some reason they won't recognize transportation right now as Frontline, but we are. Our ATU International, which we're represented by Great Leader John Costas, nationally throughout Canada and the U.S., we've had 36 deaths in transportation of the ATU, and that's ATU alone. Not the majority of those deaths in transportation has been with TWU in New York, the Transit Union Workers Union there, and they've had over 60 deaths. But throughout the transit system is still up and running. Workers know that their co-workers are dying and getting sick rapidly, but they are still coming to work in order to provide for those essential employees to be able to get to work, like the nurses, the doctors, the food service people. We're understanding, when the union, for the things that we need, what we're calling for a demand right now is for the government to provide stronger worker protection. That means give us the proper PPEs to do the job to help you, to help the nation with what we're going through. Fortunately, right now, within the ATU itself here in Maryland, Baltimore, we haven't had any deaths. And, and that's a prayer and a blessing that I wake up every morning praying for not to happen before I go to sleep. But locally, we have had 11 reported cases, and there are some that haven't reported, but they have just self-quarantined, and but they are still fear in coming to work when they find out that somebody has it, or when they read the paper and find out that transit workers in other states are dying from it. But and we too have not, received the hazardous pay, and we're not asking for abundance of money, asking for all the money that has come through the stimulus package. We know that the state has received $385 million of that $25 billion that was granted for transportation, but it came in with no oversight at all. So the money that should be granted and can be granted to protect the transit workers, it's there. And we just wanted to, hey, use it in the right way. All of us, I think, no matter where we stand, what agency we're in, or what union we're in, or who we represent, everybody want to flatten the curve for the nation right now. And from my perspective, I think that if you protect our bus operators who are coming to work and willing to transport people to these essential jobs, we can't look at it from a perspective of us getting it from the public. The government has to look at it from a perspective of, if I protect the transportation worker, he won't potentially affect his co-workers, which won't go out there to the public and then create an addition to this pandemic. Our international and even within the administration of the MTA, they'll tell you, we've never called for a total shutdown of anything. And as Ricard stated earlier, they have cut back service. The service, from our perspective, it needed to just scale back, because it's hard to police when the public feel as though that there's it's free transportation, because right now what they have done is red door boarding on buses. So nobody's passing by the fare box and no fares being collected on the bus. But in the subway and light rail system, fares still being collected, but those who are unnecessarily catching this transportation are just jumping on it just to ride down the street or go to places where they don't have to. But they're presenting a danger to those who are out there, and they're also making it overcrowding for those who need the transportation system. So those are some of the challenges
Right.
that we face. And I will say it is hard to police a situation like that, and a stronger message needs to go out there to the public. I mean, every single day that message needs to go out, if not twice
Yeah.
a day, you know,
Yeah.
to assist with that. But 100%, I'm going out. I'm still, we're still open. I'm not working from home, and we're still assisting our members. And any way that we can assist any other unions, as far as ideas that I may be able to take back to the administrator, we would like to see, if you cut the service, but still, yeah, provide shuttle services for Amazon, provide shuttle services for all the hospitals, for the industries and the food services. If that needs to be done, and they can do it in shift schedules, look, I'm all for it. I'm supporting it. That has been an idea that we've sent to the administration, and hopefully in their planning and schedule department moving forward, for however long this may have to last, that will be done.
Yeah. Yeah, that makes sense. Well, thank you. Thanks all of you for those overviews, really important. And there are a couple questions in the chat. Those on with us. If you have a question, you can put it in the chat. We also have a list of questions that some of you who've joined us sent in beforehand. So I'm gonna start with some of those. So one of the first questions, just really general, you know, what can people do to support our public sector workers whose union rights are being violated? You know, what are some of the steps that we can take to be supportive and to be advocates?
Sure. I can start with that if you want.
Yeah, go ahead.
Look, I think many public sector workers, right, and right now have a union contract, right, and even here in Maryland, our state workers, have a union contract. The union contract's very clear on items around health and safety, right. I'll leave it up to anybody who's watching on if they think it's important for facilities to have health and safety plans right now to prevent the spread back into the community, right. Those are the kinds of things that are in our contract. There's a provision that requires the state, when there's an emergency condition such as a disease outbreak, which I think we would agree we're experiencing right now, to pay workers showing up to work, provide them double compensation for the time that they're going in. That's important, obviously, to incentivize, making sure that we can fully staff these institutions right now. I mean, we've got people who make hundreds of thousands of dollars, right, who hear that there's a COVID positive case in their institution, and they're questioning whether or not they should call out and stay home. And imagine, the dietary worker or the, nursing assistant that makes, $12.13 when they're faced with that decision. I mean, double pay is important. These are things that we're unfortunately having to push back on the Hogan administration on right now. They're not honoring those provisions of the contract. And so understanding that when unions fight to enforce contracts that they have with the administration, it's really for the public benefit. I think that's the first place to start. It's not about anybody being greedy. It's about, making sure that, we're doing everything in the best interest. I also think, look, moving forward on this thing, we know that there are, there are unfortunate budget revenues that are happening. And if it's, our members, if it's, Mike's members, I think, look, we're funded by tax dollars, right? And, moving out of this thing, I think Marylanders are really going to decide, these, how essential these services are to them. I mean, I think we can agree we don't want to become like Nebraska right now, who is, doing whatever they're doing over there. This is Maryland. Like, we live in a good state. We want our government services, and we're going to have to find creative options to keep those programs going. We were facing an incredible staffing crisis heading into this. We hadn't rebounded from the Great Recession. And so the idea that there are going to be even further cuts to services, I mean, it's really going to be a pretty dire situation in terms of the types of services that the people are going to be able to provide moving forward. I can give plenty of examples of how the staffing crisis is impacting, right, the response that we're doing right now. So I'd say, look, we've got to continue to fight back against the notion that, it's okay to bail out, billionaires and major corporations, but not the people that are on the front lines every day. And I understand Congress is, working on an aid package to state and local governments right now. It's crucial that gets through,
It is.
and that, you know, we don't have
So,
a situation where people are risking their lives right now only to be laid off in 2 months.
Right. Yeah. I mean, I think that's a great point. And I think, you know, one of the things that we're seeing is that, you know, there has been some pushback or perhaps some misunderstanding at the federal level about how important it is to fund state government. You know, sometimes people are, oh, do we really need more workers? Or what does a staffing crisis really mean? You know, how does it doesn't affect me. There's, you know, there aren't enough people or positions being filled at these agencies. But what we're seeing now is it does, right? It affects everybody. I mean, it always does. And sometimes you see it more than others, depending on the position that you're in. But if you have a loved one who's in a nursing home and there's not enough staffers, or, you know, you are relying on transit to get to work and there aren't enough drivers, then it's a huge issue.
Well, and let me give one very real concrete example. There are fewer unemployment insurance claim specialists today than there were in, you know, before the Great Recession. You know, our unemployment claim specialists are just as frustrated as, you know, Marylanders are right now that they can't, you know, I think they've got waiting numbers at this point that are in 6 digits, right? On getting back to people. They're just as frustrated as Marylanders are. They, you know, they come to work with a spirit of public service, and, you know, those are the positions that have been cut over the last decade.
Right. Yeah, they're very thin, right? The Department of Labor, also the Department of Commerce. You know, we have people, they had to hire outside people. I had saw, you know, to review loan applications, right? And there's still people, small business owners, who are waiting for loans, and it's horrible and there's not enough transparency. But one of the problems is we don't have the staff, right, to respond to people. So no, I think you're totally right. Yeah, thank you for that. And how do you think we should, another question is that came up a couple of times, is how can we bring community support, including material support, to union actions that are going on now in our region? You know, how can people, and we'll have, you know, your contact information on the last slides, of course, but are there things that you're doing to support your workers that members of the public can get involved with or somehow show support? I know there was a question in the chat about how much PPE do you need? Like, are there ways that people can be supportive of your workers?
Yeah, I'll just, so we are, again, we're spending a lot of time advocating to our congressional delegation, the Maryland congressional delegation. And we have, again, the major asks are for increased testing. Another thing that we're actually asking for that not a lot of people talk about is the increased contact tracing, which is if you've been infected, everybody that you've come in contact with needs to know so they can also be tested. So that's another thing that we're advocating for. Of course, the increased PPE and the pandemic or hazard pay. So if you look on our page, and I hope Delegate Lehrman can share it, but we have a 1-800 number that you can call, and it will directly connect you to your member of Congress. And then you can just, you know, let them know that you are, you know, trying to advocate and be supportive of essential workers to make sure that the folks who are risking their lives every day, that are on the front lines, are actually getting the things that they need. I know, and you know, in Congress they're the ones who need to one, correct some of the things that they've, you know, holes that they left, but also to make sure that the next packages, like Denise said, they don't just protect corporations, but they actually protect workers. So that's what we're really truly asking for folks to please reach out to your congressional reps.
That's great. Thank you. And I will share that shortly. I will bring it up. It's just 1199seiu.org, right? So a question, Mike, now that riders, transit riders are required to wear face coverings and the MTA is making masks available, have conditions on transit improved? What still needs to be done to make it better? Any thoughts on that? More PPE or other ideas you have? Do we need more buses running so they're not as crowded? What are your thoughts?
Yes, we still need more PPE. The ones that they have provided are very minimal. Right now, there need to be a consistency behind it, and them giving us the PPE. Also, too, the overcrowding of buses. Now that they have limited the service, there's overcrowding on the buses, but we do have the manpower. What MTA did when they limited the service, they feel as though that they don't need as many people. So what they shut off the overtime work, that would be people who will come in before run, after run, or on their days off. But those are extra bodies that you can use to fill in the gaps of the service that you have cut to reduce the overcrowding on the main lines that they are operating. So, and we have been making a call to the administrator to take that into consideration. Also, the policing of the bus stops. With the governor, we have the National Guard here. If they can police the bus stops or the MTA police officers as well, when they don't see people with face coverings, let them know, hey, that you can't be in this area and you won't be able to catch the service that's coming along. And also going back to the community outreach work, we've been also reaching out to like the CMTA. I've sat on a couple of their webinars on the Sierra Club. So, we also have to extend out to those community who are involved and letting us know and using our voice to get to the particulars of government that will be able to assist with some of the areas that they see that need support. But once again, I'm strongly urging that to the governor that, if you protect those who are out on the front line and recognize it, then it will help in his agenda to flatten that curve along the way, dealing with these are proper steps that they have put in place to flatten the curve, but there's still more details that need to be addressed in it.
Okay, that's helpful. And here I'm going to pull up, let's see if I can do it. See if I can pull up this, here we go. Let's see if this works. You guys see this? Flip the phones. This is the 1199 PDF talking about how we can support and make sure that folks are getting the funds that they need, getting the PPE they need, and getting paid. So here's we'll leave that up for a little bit just so people can make a note. You can call 844-89-1199 to be connected to your elected official's office. Tell them who you are and express that our workers need more PPE, more testing, treatment, hazard pay, and increased healthcare funding to states and providers. So I will, when we send around a link to this, we'll also be sure to send around this PDF so folks can share this image as well. So thank you for providing that. That's great.
Thank you.
There's a great question, which I find really interesting. So in my former life in law school, I wrote an article all about OSHA and our occupational and safety and health work that's done, and how really OSHA and our OSHA laws don't work without unions to help enforce them because of the system that we created and how difficult it is to report and the follow-up and protection for workers. And what we're seeing right now, of course, is that OSHA hasn't acted at all to create an infectious disease standard. There's nothing federal. And MOSH, the Maryland version of OSHA, hasn't created an infectious disease standard either. So the question that somebody wrote in, which I love, is that Cal OSHA does have an infectious disease standard, and labor activists in other states have called on their occupational health and safety departments to establish an emergency standard. With a vaccine for this coronavirus nowhere near ready for deployment, is this a moment that we should be demanding that MOSH begin the regulatory process to create a standard to protect Maryland workers? Love to hear your thoughts on that. I come down on the yes, we should have one, but I'd be really curious in hearing what you all think about this.
Yes, absolutely. I think we absolutely do. I could spend probably the rest of the time just talking about OSHA and everything we need to do there and with MOSH. But we absolutely need infectious control standards. And look, the reason it's important is because when you get obviously federal guidelines that get pushed down like that go to states, not only does it, impact, workers who have collective bargaining agreements and who have unions, but those are standards that then are applied to the rest of workers, right? And so it really lifts everyone up. But I think, look, if it's standards around infectious control, if it's standards around workplace violence, right? That's something that we recently actually had a bill on that you co-sponsored, which we appreciate, Delegate Learman, right, on getting workplace violence standards set. We rely on these agencies to make sure that there is a standard. And, speaking with MOSH, I think we've got a similar experience there. We represent the MOSH folks. We've got to make sure that those agencies are fully staffed too, to be able to go out and do the inspections. I think that's the other part of it. But absolutely, it's something that we should absolutely be pushing for, and that second part about enforcement is the big part, and absolutely, it's a lot easier to enforce standards that are federal than than not have them at all and do a piecemeal, you know, facility by facility or agency by agency. So
Yeah,
we
no, I
would
mean,
be
that's a
happy
great
to work
point.
with you on that.
Yes,
And
no, I
everyone
would
else
be
on this
too.
call.
I might make you read my old law review article.
I would nerd out about that and actually really enjoy it. So.
I can't remember. Loyola Law School in New Orleans published it, but it's
Okay.
yeah, it was a labor of love, but it's such a big deal. And you know, I mean, the other thing, and actually, I wrote an article with Sarah Elfreth that was in Maryland Matters this week on environmental enforcement.
Mm-hmm.
But the issue is everywhere. It's, you know, we
Right.
pass these laws, right, on clean water, clean air, worker safety standards. And the question is, who's enforcing them after we take all this time and do all this work to pass them? And that's another issue of staffing. You know, we
Right.
do not have the staff at these agencies, right, to enforce a lot of these protections that we're passing. So
Right.
thank you for that. Any other thought before we move on from Moshe and safety and health? I don't know if Rikara, Mike, you have anything you'd like to add?
No, I think I totally agree. I think Denise covered it
Yeah.
awesomely, but yeah, I think it's past overdue.
Yeah. Okay. Great. So a couple other questions. How can we further protect the health and financial stability of our essential workers? And you all talked a little bit about this, but just to bring it home, I'd love to hear you talk a little bit more about making sure that, you know, during this crisis, but also after this, because it is going to end someday, that we do not forget that our essential workers, our frontline heroes, are often the people that we had you know, people don't want to pay $15 you know, an hour to. So would love to hear you talk a little bit about how we can further protect the health and financial stability moving forward of our essential workers.
Yeah, I would just say really quickly, I think that one of the things that's really become clear to me during this pandemic is that a lot of, like I was saying before, a lot of stuff that we've all been fighting for years and years and years, it's even now more clear how much more we need those protections. You know, paid sick leave, increased access to health care, higher wages, you know, making sure that people have access to affordable childcare. In Baltimore City, we're dealing with increasing water rates constantly, right? So it's just made it clear that you know, one, that we're behind the ball, but that these protections, they shouldn't be temporary. And I think a lot of stuff that we've seen at the federal government is set to expire, but we're going to be really fighting to make sure that some of these protections that were put into place, they extend beyond, you know, next month or the month after that, and they become long-term. And I just want to say, I think that it also helps to, for me, really make it really clear and visible about the union difference, right? So I think that, you know, Michael and Denise and myself, a lot of the things that we've seen come down the pipe lately, although they were too late, is because labor and unions were the ones truly fighting, you know, for some of these protections that have been in place. And, you know, we've been the ones really trying to advocate for the health, safety, and protection of our workers, and not just our workers, but workers across the board. So yeah. It's, you know, again, I think it just helps to really illuminate that, you know, these are things that we should have had in place a long time ago, and they shouldn't just be during pandemics.
Yep, I appreciate that. Mike, in Baltimore, there's a question here. In Baltimore, transit ridership isn't down during the pandemic nearly as much as it is on the DC Metro or the MARC commuter train. That's in part, of course, because nearly 40% of transit riders are essential workers. What are union members who still going to work during this crisis experiencing on their commutes? And would love to hear sort of how's the bus system running? You know, are people, you know, is there overcrowding? Is it on time? You know, what are your drivers experiencing, and what are riders seeing?
The reduction in service is reduced to a Sunday schedule. And to fill in the gaps, what MTA has done, they have created triple runs which will be regular service running during the weekday that will be provided to those places like Amazon, along those major bus routes that will still meet them get them to the transfer points, also for the hospital workers, also out to BWI. The light rail and subway system, they are also on a weekend schedule, but the metro system is kind of essentially, it's at a reduced service, but it's almost a regular service. Their weekend schedule is not that much different from their weekday schedule. But what the operators are saying, with the overcrowding, they don't want to pass anybody up. But also when they look at how crowded the buses are sometimes because there is limited service, they do have to pass up a stop. And just yesterday, I got a report from an operator who, once she had to go a block down to let some people off so that more people wouldn't get on, a guy chased the bus down and threw a brick through the window. And it frightened her, but she continued on. She called the police, but that was another disruption in service. But the workers themselves, they have the shields for protection, the limited PPEs that have been given to them, which is just a mask and some hand sanitizer that has been given to them by the MTA. They are using it. They do feel a little bit more protected, but the proper protection, because there are things coming out about the ventilation system that services through. And if the public isn't practicing the social distancing, there's still a fear of contamination that can get to the operators with that. And also too, to try to protect, to further protect the health rights, we got to blow the dust off of some of the acts that we've never had to enact. Like, and I'm sure that other unions, like with Recovery Board, like she mentioned, we have to reach out to the government and continuously let them know what we need and what's going on from the front line. But if we blow the dust off of some of the Transportation Assistant Acts of like 1982, the Federal Occupational Safety and Health Act, and the National Labor Relations Act, and I'm sure the other unions have acts as well that needs to be enacted, but we just got to, like I said, blow the dust off them and have those things enacted.
I just got a text that OSHA is 50 years old this year, so time for version 2.0. Thanks, Terry, for the text. So yeah, well, this is great. There was one question for me, and I don't want people to think that I'm, not asking tough questions of myself when you send them in. So one question was, what legislative action could the General Assembly take in a possible special session to recognize and protect frontline workers? Even though it's directed at me, I'm happy to speak, but I'd love to hear, if you each have sort of a top two or one, top one or two things that you'd like to speak about as well. I'll say, I think one of the things we can do is make sure that we are eliminating the loopholes in some of our paid sick leave laws. We don't protect people under our paid sick leave law during public health emergencies. So I think closing some of the loopholes in some of our laws are really important, expanding sick leave in that way. Of course, childcare protections, making sure that we are adequately funding transit so that workers can get around and so that we can, and also I would also add MOSH and including strengthening our occupational safety and health standards. Those are some of the things that we could do, I think, to help protect our workers. But I'd love to hear sort of a top one or two ideas from you all as well, as sort of a way to close today.
I'm happy to start. Look, there are going to be some very tough decisions made on the budget coming forward, right? And we're definitely going to look to the legislator to ensure that, again, frontline workers are protected and that we protect the essential services that they provide. I would also add, not much is known yet on what the long-term effects are going to be on COVID exposures and COVID infections. Some other states are moving to add, COVID-19 to the presumption for workers' comp, which is something that I think, Maryland should certainly explore. But I think we're going to be very, very active in making sure we protect jobs right now and not add more folks to the unemployment line.
Yep, good. Makes sense.
Yeah, so just one thing, I know we're already experiencing a shortage in healthcare workers, and with the closure of schools and people unable to get into nursing homes and hospitals to do clinicals, it's going to be very important that there's some type of legislation that allows these folks to finish their degree so they can actually start working, and so they can get into, we're going to need their help more than ever. So that's one of the things. And then just like on a more general level, I think what we also see, especially in Baltimore City, is with all the distance learning, there's a huge divide in different communities based on your zip code, whether or not you have access to the technology that you need. So I would love to see the General Assembly do something to address that huge, divide for our students as we move forward.
Yep. Thank you. That is a real issue. And we're going to be doing a webinar on the digital divide and bridging the digital divide on May 19th, because yes, I think, we've known that it exists for a while, but this has brought into sharp relief how truly devastating it can be to not have access to the internet, and how it really needs to be a public. So thank you. Mike, any sort of top priorities for the General Assembly from you?
Yes, nobody ever thought that being a essential employee would mean that I would have to make a decision to come to work and risk my life. You only thought that as being a firefighter or a police officer. But now we're saying, and what we're dealing with in the nation today, that it's more than just who they are. So I would like to see just a regional pandemic leave to be able to be put in place that will apply to all who are considered essential and frontline workers. Also, too, along the lines the same as what Ricard has said and Denise has said, and you have said also, Brooke, about a hazard pay, to show appreciation for the work that's done when it's time to do it, and not just on the level of, hey, you have to be a firefighter or police. And also, too, as they mentioned as well, like being last, I'm kind of repeating everything that everybody else has said as well already, but furloughs. Hearing the staggering numbers of the for unemployment is heartbreaking. So we should have some type of furlough leave, furlough paid leave protection act put in, or some type of layoff, more layoff protection.
Yep. Well, I appreciate that, and I appreciate all of you being here today. I have put your contact information and my contact information on the screen in case you want to be in touch, and we will be sending around your contact information and the PDF that Ricard sent me on how to get involved and how to advocate to everybody who signed up for this. A huge thank you to all of you. I always like to close these sessions with just a note of gratitude. Like I said earlier, I have the luxury, and many of us do, of being at home. I may be teaching a first grader and dealing with constituent issues, but I know I'm safe here. And I'm here because there are many people who aren't at home today and who are doing essential work in our communities, around the state, in our fields, in our factories, in our nursing homes, in our grocery stores, on our buses. So today we set aside some time to honor them and support them. And I hope every day we recognize how fortunate we are to have people on the front lines, and that it's up to us to make sure that they stay safe and to advocate for them, because it can't be all on them. So a huge thank you, Denise, for Mike, for all of the work that you are doing. You're amazing advocates, and I'm so grateful that you joined us today to talk about this. Please keep in touch and keep up your great work, and stay safe, and happy May Day.
Thank you.
Okay.
Thank you.
Thank
Stay
you
healthy,
so
everyone.
much, all of you. Take care.
Have a safe
Thank you.
Thank you. Happy May Day.